Hello, my name is Marta Zinyuk and I'm a registered nurse in Austin, Texas. This is my grant proposal presentation that addresses surgical site infection occurrence, utilization of resources, preoperative, intraoperative, and postoperative care. PICO question. The PICO question for this research is there a relationship between preoperative, intraoperative, and postoperative care and the prevalence of surgical site infections in 18 to 15-year-olds undergoing general, vascular, cardiothoracic, orthopedic, and reconstructive surgery? Surgical site infections are increasing at a staggering rate and becoming a major public health concern worldwide, Sitar et al. 2019. According to the CDC, healthcare-associated infection prevalence survey found that there's an estimated of over 110,000 surgical site infections associated with inpatient surgeries in 2015 alone. Hospital-acquired infections are currently classified as occurring within 30 days of the operation, and occurrence is increased with the patient's age, ASA class, the classification of wound, scale, as well as the experience of the surgeon. Combating surgical site infections entails a collaborative effort of preoperative, intraoperative, and postoperative care. The CDC guidelines recommend antimicrobial prophylaxis, glycemic control, maintaining perioperative normothermia, intraoperative oxygenation, and use of prophylactic antibiotics to be in place. Inconsistent practices often arise due to conflicting research evidence and variations in clinical preference, which ultimately compromises attempts to limit or reduce harm and patients' risk of surgical site infection and other wide wound complications increases. This is becoming a major public health concern. According to the World Health Organization, recommendations to prevent surgical site infections have been conveyed. However, the translation and utilization of those guidelines into clinical practice remains an issue that has not been adequately resolved. Although standard guidelines are mandated, healthcare providers commonly deviate from them based on their own assessment of the situation of the patient, which is a significant concern. The purpose of this is to conduct studies that will help further knowledge on how to decrease surgical site infections. It is critical to further advance research on preventing surgical site infections by discovering the effect of preoperative care, such as the use of prophylactic antibiotics, use of chlorhexidine prior to surgery, and the role of comorbidities. Also, to determine the effect of intraoperative care, such as changing surgical teams during wound care, following guidelines and reasoning behind personnel not following protocol, the effect of continuing education for healthcare providers, and assessment of knowledge. The purpose is also seeks to answer the question, is there a relationship between preoperative, intraoperative, and postoperative care and the prevalence of surgical site infections in 18 to 15-year-olds undergoing general, cardiothoracic, vascular, orthopedic, and reconstructive surgery? Particularly, the study has the following sub-objectives: to provide review of constraints in reference to following guidelines, to review current guidelines and practices in regards to avoiding surgical site infections, to outline a framework for managing constraints, in addition to determine the importance of continuing education on updated guidelines. Gaps. Knowledge gaps exist between the best evidence and practice with regards to preventing surgical site infections from occurring. Despite guidelines, literature revealed inconsistencies and inappropriate preoperative, intraoperative, and postoperative care. Despite available evidence, only 57% of patients followed directions in preparing for surgery. This conveyed that there is an obvious inconsistency in the studies and the statistics that are being reported. Other knowledge gaps in the literature were that there was a lack of group randomization and follow-up period for detection of an SSI was limited to 30 days. Bepco et al. 2015. Further, some other knowledge gaps inconsistencies is the effective timing of the preoperative cleansing or shower, the total number of antiseptic agent applications, the use of chlorhexidine gluconate washcloths, and the comparison of antiseptic agents. Proposed project methodology. The participants will be recruited by criterion purposive sampling by their doctors, nurses, at all surgery centers associated with St. David's Medical Center. The sample will include patients that have had surgery in the past 3 months that have resulted in infection. The surgical intervention and infection variables will also be collected to determine the correlation between following guidelines and outcomes. The sample size will be ideally 900 participants. Prospective cohort studies will be chosen based on exposure and carried out from the present time into the future for analysis. Preoperative, intraoperative, and postoperative data will be collected using a standardized questionnaire. Significance to the field of nursing. Since nurses are the healthcare professionals who have the most consistent day-to-day contact with patients, it is crucial that they adhere to standard infection control and transmission-based precautions to further prevent spread of healthcare-associated infections and resistant organisms. Burnett E. 2020. Proposed change. Combating infection post-invasive procedures requires an integrative approach with measures taken during pre-op, intra-op, and post-op. Ultimately, following protocol and guidelines, patient education, pre-op, and post-op care is crucial in avoiding infections after invasive procedures. The proposed change would include implementing a combination of essential strategies based on proven guidelines. Why should this be funded? Because implementing the proposed changes would ultimately decrease the occurrence of surgical site infections. For example, providing education classes on the updated guidelines would enhance the delivery of care. Also, due to surgical site infections being one of the leading causes of hospitalization, it would behoove inpatient and outpatient facilities to focus on in-depth education for healthcare providers on prevention of surgical site infections and following evidence-proven guidelines. By adopting an education program, it will assist in avoiding surgical site infections and ultimately decrease Medicare expenditure. According to a cross-sectional study, only 6.7% of healthcare providers had good knowledge and awareness of SSIs, and more courses were recommended, according to Albici et al. 2020. Avoiding post-surgery infection by following proper protocol is vital. According to research, preoperative and postoperative care is just as important as intra-op. For example, preoperative antibiotic prophylaxis has become a standard for surgery, such as implementing artificial product or bone grafting. According to the Joint Commission for Disease Control, advanced practice nurses play a vital role in educating patients that are having surgery and their families as needed about surgical site infection prevention while implementing policies and procedures. The impact of surgical site infections on the patients is detrimental. Therefore, considerable efforts need to focus on implementing multidisciplinary prevention strategies that require preoperative, intraoperative, and postoperative care. It is essential to provide healthcare providers and patients with vital knowledge to decrease SSIs. Conducting this study will help further knowledge on how to decrease surgical site infections. The research team is looking to get a grant of $5,000 to aid in its evidence-based proposal. Please consider this proposal and thank you for your time.